Many patients ask me what is the difference between FUT and FUE, and is even there a role for FUT or linear scar hair transplantation? And I think FUT and FUE have a role in hair transplantation. It's more about what your goals are as a patient and what type of hair you have. So let's get to the basics. FUT is essentially linear scar, where a small scar is made in the back of your head in a linear fashion to harvest out a strip of hairs. This was the most popular procedure and has the best grafts possible because you're harvesting the hairs intact, de novo. FUE is where you remove each hair graft individually, and depending on which type of technique and device you use, can provide a comparable level of hair graft as an FUT. So, which one do you use for which patient? So if you wear longer hair, and you know you're always going to wear longer hair, and that's longer than a 1 guard or 2 guard, I think you should consider FUT as at least an option. If you think you're going to go shorter with the 1 guard in the back of your hair, or shave your head, or you just don't want the idea of having your hairstyle flexibility limited, you definitely should consider FUE. In my patient practice, most of my women and my older men who've had the same hairstyle for many years, which is longer, tend to go with FUT. My younger patients and patients who are more hairstyle conscious tend to go with FUE. Both are reasonable options, but you just have to know what you're expecting.